Good morning. Mutie free baby. I'm Dr. Ofori, and then the health and wellness show here, bro, from Chicago, Illinois. And then I think say you become something about stomach ulcer. And GERD. Yenya Dr. Kunini do ha boy am etinya church sa. Yare we mu na yati ase yi na say your questions be answer. You try say be answer. Facebook and YouTube nti wokɔ Facebook wobɔ Ako Radio wobɛte yɛn ka ɛwɔ hɔnom live and clear afei nso so yɛwɔ sɛdeɛ meka no YouTube na yɛwɔ ayi nso so tune in nso so wokɔ tune in na wobɔ Ako Radio wobɛtumi ate yɛn ka yɛ audio feed no ɛkɔ ɛwɔ hɔnom na sɛ na ɛbɛstart no yɛde mpaebɔ ɛbɛsrɛ ɔtware ampɔn sɛ ɔbɛbɔ yɛn na program yi bɛkɔ yie na ɛbɛkɔ tɔten yen semre kwa ne bekwa koje nkrato kakra bi na se ba ye de Dr. Owusu Ansah ebeba so na wa train nipa oye na afin so ye de komo no ahyehye so nti men ko ba bia tam chukuni eba.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Ba eni ma medufi oye dwuma odukasi anopa biara me nua ba sori ahoɔden mu na ɔkwadwuma on complaining da sɛ ho ba bitutu no sanso na me bra o efitani o tu engine ni o pagya engine ya ka adwuma sɛ de sitie da bi biara no ho dendenden me ameyire o store no adi ni dwa me yire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanam papa ne mfia konkan ɔno so complaining da sɛ ho ba bia ne ya ɔsori anopa na no afanse kan no ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de bedampo na adias nanso men sorry da krokran ka se me hu ba bia me ya ni nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ni nyina ni kowa mesha kurani eyaduru a wonom a ebo ni padua no ema wo se pi usita me kanfo ama wo se won so no kowa mesha ni bi na beboa na aboa no obusua na yare da ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. Say wo pe kwa mixture ato ewa America brochi memu call One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonana Feno Agenda, it was 0773-610-1112.
Kowa Mesha Abushia Amintas
FDA Asheshe Ejedi Nkratui Ajiatum se eye.
Yo yedamase se masan ene yewo hanom na yebeton komo iso ense kowa Mesha any well remit in African's United African Organization and also yasine mede ene jumadi ebremo yes semre kra no ense ene no mohwe a me na mti adwom wa ha kwame ontumi makiansa enti mede ene komo na ya tuni din Stomach Ulcers and GERD ense yenya doctor bi wo ho beboan na wachechire mu Nti me nsɛm rekora no me Dr. Lobet Owusu Ansah ɛbɛba afidie so na waba bɛka kyerɛ no. Doctor na ho te sɛn? Pato bɛ o meet you ho amaya.
Yo, me that's it. Me ho yɛ nyame adom.
Wonderful. And say you who had check a crab nyame adom and say we look very fit na afin so. And then on topic e can one some ni ade bi I think say you know what can one some maybe atwam. Yes semre na baby saw nipa wo ye na dwuma be na wodie na tiefo so mo mo ho bia. Nipa kra wo.
Yo, me that's it. Dudu one wa frame Levette Owusu Ansah. Me a pharmacist or Illinois has a my jumana say me share other pharmacists, so me was staff me share also me a pharmacist inpatient. And you know, my juma as a pharmacist for over about 22 years now. To do one I don't know me kunu me won my for they walk about me no briefly.
Of course, school Ghana school be na akoye say a tiefo person.
Yo, me school called the baby bebre.
Good.
Sabi a woman wa broche, but me son me call school kakra wa Ghana.
Okay.
No, sorry, me started wa Nigeria. Papa na papa ye professor inti na to coin inti. Me call school wa my primary years were in Nigeria. Secondary school me call Ghana, me call Wesley Girls High School.
Okay.
And to me free when I'm sent back to America at the age of 17 into my hatch into me call University of Georgia because here biochemistry and molecular biology first degree. And I'm a branch called pharmacy or Midwestern or Downers Grove, Illinois. Into
until I'm back over Chicago, I'm right. That makes sense.
Yeah.
Oh, great. Yo, yeah, that's to say, watch a tree when you power here now. Excuse the beer. You show you today. In fact, Nipa Kwase beer, my hair doctor, what being in room Casa Pai. And see, young Chahon crown, I think say, you best start in Comodino. Now, you're way, I really, I say, oh, can you ya power back way if you he said, your fiare idea sometimes it's me very they are only a different level among Kofu, especially among work ulcers. Some of us maybe say work a crabby or why sometimes I can't why in Yamaka. And to maybe say peptic ulcer no crown a area is it the same as say obi makana na be a stomach abscess in yard? Of difference anyway.
Yo. Well, my disclaimer, I'm a pharmacist, I'm not a physician. So me role no ye more of semi after your diagnosis and crofona, yeah munro, I have a general understanding. Based on my understanding, no mecheche mumukakra. Say Dr. BTA na or interject or add it to what I'm saying, they're more than welcome. Peptic ulcer no aye na ho te said de eye nkronkro bi nkitinkiti bi a ewo ye yefunu mu. Inti no they're like sores in the lining of your stomach. Na the most common symptom na de etumi ma ye hu se obi enya ulcer pa ye yefunu yare obeka se ne yem ye ne ya. Na ulcers no ye omu ahodo mienu. Abrofo be friend gastric ulcers and duodenal ulcers. Gastric no de ewo yefunu na nkasa no mu. Na duodenal ulcers no de ewo you kind of say intestines yensuno. Is that correct?
Aye.
Your small intestines affected the small portion, the lining of our small intestines. And usually, the most common cause of ulcer bacteria. And you come to say the yana you feel so be a comedy as so could and no cry one shot you are secreting acid, but as we go along, we are back on once. most of the time no a bacterial infection. Any long-term use of pain relievers. Simply put, pain relievers to say offer ibuprofen, naproxen. Done apotoka say different NSAIDs, non-steroidal anti-inflammatories, and even steroids. And Rono affected it eats away the lining of the stomach and eventually will lead to ulcers.
Okay. Just say ulcer a crew in general, right?
A crow generally, a crow. A crab, a be a bacteria, a didi nama adane a whole a crow.
Okay. Now I mean you said it kind of pathophysiology and physiology. Now I am more of like a didi was a crotal skinner. And crow atoll difference and do. And see what kind of bacteria I could remove now. Usually in the basal the treatment no be different, right? Because I say cra emco, right?
Yes.
Okay.
Underlining to treat usually, let's talk about some of the symptoms, then we're going to treatment.
Right.
Into me can say you no yare. I'm say me share dan ya ulcer that. Into meaning if anyone can describe it, I'm say a burning stomach pain.
Right.
That is as we yefunu emuhwehwe wankasa. And I say where did you mean? Because you are bloated and you feel as if you have the feeling of fullness.
Right.
And in conform more also I'm tie kisu meaning say obi or that experience. But say they are belching or your friend kiss you. Would the fatty foods to say we nam near the idea it to me affected. Obi so or because of heartburn.
Right.
Not just as an akuma hoshishino or the chest. We say a brother friend epigastric pain. I said it's not going down, it's rather coming back up. And then the feeling of nausea, which is that's all ufe. So those are the most common symptoms. But the stomach pain and then a cardinal symptom. Say obi was stomach ulcer.
Osha epigastric pain. Sometimes yana a yaw away with different area. Because yam super human and I asked anything. And see what's not shrimp like epigastric in area bend and when I said about
That's a good question. This is where I need my diagnosis chance to.
It's a mania picture do or her. But I say usually the epigastric or the mechanism airco was sternum.
And I think say I walk one more quadrant, whether left or right quadrant, I believe. And I say sternum no in the middle of your chest.
Right.
And one says one more map CPR, that's where you pump. It's right, like in between your breast, your friends say. That's correct. Into sending I watch an epigastric region, no. Right, it looks like it's right below your breast plate. And I'll be say shisho and kasa say yedimeko. From what I've known or what I have come to understand, I say mekwankasa and shisho. Yeah.
Oh, okay. I think that if one more Facebook number the doctor described now. Share baby ribs no one and finfini open no but say a yarn no for epigastric pain. And I'll come back you say duodenal, right? Your gastric in your duodenal.
And your duodenal no dear or small intestines.
Okay.
I don't know if you have a picture to show, but small intestines, no. When you have ulceration and sores in your small intestines, and you're different from the gastric ulcers.
Right.
And those also can tend to bleed. And we who say obi wa nani stool no, there's bleeding in their stool.
Okay. Yeah, until I think say a chief for be who Facebook ya diagram be at one we young na wo onsa okwa be a tube na wo dey shame.
Right.
And I ultra we young kakra be a baby did go first no. That is what we do no na ura.
Right. So Ubeka say yeah, intestines na hona all the passage of stool takes place.
Right.
Into no. Ube who said to the beer obi wo na moja e won stool for that reason.
Now maybe say a do stage na I just I can see because what started passing moja. Right, I just a corona brain and be
right.
And nobody can comment kakra on how
well, usually, when that happens or when that occurs, that is probably through diagnosis through blood work.
Okay.
On your blood work now, who baby hemoglobin levels are,
right.
And that will probably who say you are losing blood. Based on your symptoms, collaborate your symptoms with the blood work and come up with some kind of differential diagnosis to suspect, say, yeah, you do have a duodenal ulcer. Usually, there's really no drug to stop the bleeding, but to help to decrease and lessen that whole process from going on. Because, like I said, remember in Ruby Wahua, a Western, a cause to say, your friend saying, non-steroidals, anti-inflammatories, they are the ones that really are the culprits or cause the worsening of the symptoms. Usually, you will know a kettle and as a sort process, disease progression, so on.
Oh, good. So I think pretty clear from what Dr. Ekano the stomach ulcer in a way, you crew and out right now. Sometimes from time to time, say, and we are the incredible between us that say, oh, pass it, Muja was to. They're not just say, Muja is to be with Jana and one HSL was. I was so called Dr. Hona, Dr. Eden. And making sure what diagnosis amount. Now, cancer number one symptom is epigastric pain, and I say sometimes it be feeling nausea near like I say, what cocoa, and I say a bang no fast, what is the pain be upon sometimes the UDD crana and let me have an I can see. And yes, Miracrani, best sign, I share your signs and the symptoms make a crown. No, we will be said, and then crying the back. Matisse body can and Ryan to say non-steroidal anti-inflammatory. Aside from we also say no can be said in the but from collaborating himself when it didn't stomach ulcer.
Yes, late night eating so yeah they are a culprit and yeah they are a bois with the with peptic ulcer. Me kind bacteria. Almost friend in the scientific way, almost friend a Helicobacter pylori. A bacteria be that lives in the layers of the tissues. Usually, under normal circumstances, and harmful, but when there's a disease progression, it may be harmful amount. And in addition to be our pain relievers, we will be out BB Caribbean alpha Motrin, Advil, naproxen, and your masana a problem. And I may bore other medications to say fast steroids obi or osteoporosis or fat or fat drobia to say Fosamax and actonella, all those can have an increase your chance of developing ulcers. Into
Okay. No, I mean, I think that's pretty much what can bacteria that's not bacteria we no cry no. Idea be I said you to say influenza COVID and that be it is spread from people to people. How does it? How much it spread it?
I don't know how. Yeah, it's a very good question. I don't think that there's any clear explanation as to say if it spreads from people to people.
Right.
It could be through food, especially. Say ube to me I spread it halobacteria, but I don't think like from person to person transmission a very apparent. I honestly can't say that, but I'm thinking that it could be through, you can get it through food and water.
Okay. Yo, not just say idea a bit me. I will be say you test it, say will be now.
Right.
Also, maybe I do stage be most of the time. On better check, not just say some bacteria.
Right. On better test, they will always run the test to see if you are positive or negative.
Okay. All right. Yeah. Until you know I know some bacteria we know now I mean you said some of the steroids and so on in a way.
Right.
Is there another kind of say physically? I bet me cause ulcers like in terms of like say they kind of when it in term what did you
risk factors. Some of the risk factors I think will be eating spicy foods.
Okay.
We will be our pet spicy food as a so to say a kind of when didn't tell we will be our smoking alcohol. All those things increases your likelihood or your risk for developing stomach ulcers.
Right. Yeah, and I think so what very important part of it said you alcohol, erode a lot of things and cause more problems than benefits. Smoking is one of them. All risk factors, and I said maybe a man we are predisposed to stomach ulcers.
Right.
In a way, if I kind of say, what me I prevent it, and I bet me, I make sure someone has a problem with acidic food, Ubo again, I bet me I cause society. What me I call Mukakra am I?
Acidic food, no, Ebianibia, a bit, a mau acid.
Okay.
One of the ones I know of it, like tomatoes.
Okay.
And also, the body produces acids to help with the breakdown and help with digestion. Into your body itself also produces acid, and that can also worsen the disease or the progression just from what you are producing. Into na it coated the lining of the stomach to help prevent or lessen the acid production.
Right.
And spicy food, I'm sorry, spicy food we know obviously will produce more acid than a regular foods. And those are things that as I see
because very, very spicy. Extremely spicy.
Me personally, I like spicy food, so also to be honest with you, and we have to also play it safe. We have the information at our fingertips now. They say near boy and buying.
Into tomatoes, I think the garlic,
garlic, onions, all those things are didn't know, especially
Yeah.
Because we use a lot of tomatoes, we use a lot of onions, a lot of garlic. So your money now that baseline group of foods, acid production. The thing with the interesting thing with stomach ulcers, so obeying say Arabia one way, but it can become very serious if you don't take care of it. That's the issue, because you lose blood.
Right.
Until while be say I feel faint. Who maybe stomach pain and the main symptom. So we have to pay attention to our bodies and see what's going on. Obi or while best start lose weight. So they just have stomach ulcers. Right. So these are things that we need to pay attention to our bodies, because sometimes you don't know where the source of the problem is, and if it's something we could take care of it quickly, and you can come back to having your quality of life.
Right. Yo, as you said, watch it you. Am I Facebook me madam for power back ya obrago support as I said what you show enough in some share MIM all the way from Ghana. Also, Boslinga, and they want to be a mechanic. I was the diva herself, Dr. Libet, thanks for coming. And after Obi Ghana series, Obi and I said, also what you need and I would see. And I also I said, hey, acid sister. I think that okay, acid Nayana go for you show because this acid the idea for some connotation, you're going to say. I didn't know the spirit when you
acid there, well, baby, I said it depends on the category or the type of acid we are talking about.
Right.
Our bodies also produce acid. We acid,
right?
Exactly. And the thing is, we live in if we know chemistry, acid base, and neutral environment. Those are all things that determine how we survive. Actually, our survival is based on sometimes whether we have to be in an acidic, or our bodies have to be in an acidic environment versus a basic environment. But that's a topic for another day. But just to make a long story short, we do produce acids in our body, and that's what helps break down our food now, digestion.
No,
so overproduction of acid, overly producing it, and a problem.
Right. And of course, it's our problem. That's the best watch it come up. But some ever next question, we won't fat particular somehow. You GERD and so I give you a handful of I say a bushy. Now, Obi dear, I did what's Nasia, Sana, what's me, and what and no difference between the woman office and also the neighbor.
They all actually are tied into the same family of diseases, but the problem with GERD, and say, once we are supposed to the way I'm trying to explain it in the simplest form possible. Send your body AC Emma Ebianeno flow through the you can understand the track, for lack of a better word, the eating track, as I say, a coffin. As I say, a corner, you go through digestion, and then if what needs to be passed out needs to pass out.
Right.
But unfortunately, for some people, that process is delayed and is slowed down, or even sometimes due to some kind of process abnormality. It's not come out, but it comes back up through your chest. Into be a while, did not na I said the chest na eshishin biom. Into it boils down to the production of acid and not being able to to push everything down its normal track as it's supposed to go. To be said to the be na BBI back up. It has to do with some pressures in our stomach. It causes our problem. It's abnormal stomach pressures. Into, like I said, I'm a doctor, but I'm trying to give you the simplest form and how I understand it at a base level.
Right. And one, I think so. What you come on me at here, say differences in pressures. If I kind of say,
right.
Conditional, it's a key. So the idea, obviously, it was sphincters view over a boa closely baby, and you go, baby, a digesting, you know. Said a baby, and some in free form, and cost at the be a one direction.
Right. So yeah, a tube. No, I say tube na no film.
Right.
It is a tube no so a drew baby as I say a called digestion. A drew baby as I say bisu kwa. One say there's a pressure that pushes all of that down. So if that pressure is abnormal now, one say bibia be start I say a samba back. Into that backwash is what irritates the lining of your esophagus, I think.
Right. That's true. Now, so the OB can you see acid says and as we are massive decent Baba Street. I don't know to me and cause it minimum
there would be irritation. So a idea like we were saying, acid there should naturally. So wow, if you've worked in the lab before and you've seen what an acid looks like, utumu say a idea irritating, irritant. And this is why we have this problem, because anything that irritating there, right. And just imagine we are dealing with the insides of our bodies. We don't even have the skin protection. Even it's just like wushi acid egu obihun. Initially, so it's the same concept going on, but it's going on inside your body because you have overproduction of this acid.
Wow. At least animal way now anti cause major issues because I guess Yanku Ponshi in such a way said there's a mechanism of building a protection from that. But my whole question be from Obi, not Obi, so I said stomach grouching a symptom of ulcers. I don't know what you know what I'm saying. I can go for your boom crew, right?
It's hard to say if grouching, if you mean noise making.
Mm-hmm.
I don't know that grouching is a symptom of stomach ulcer per se. Make me feel say a pain, I will be feeling.
Right.
That's burning, irritating pain. And then it probably is the cardinal sign say you have an ulcer.
Right.
Noisy tummy could be anything. It could be you going through digestive issues. It could be you having gas. It could be a whole lot of things.
Right.
But for one, Becca said we were also there now on market test. H. pylori test, no any sign really. It's just a stomach ulcer.
Okay, that makes sense. And the Obina say Otiana, I think say usually gases, right? Which produces that noise making that movement of your intestinal tract and all. Signs and symptoms of ulcers. Now, of course, pain is one of them. Indigestion is one of them. More Facebook, you see all the signs and symptoms. Bloating, so come on. It be more bloating.
Yes,
that I've seen a lot. And a heartburns. To say when your heartburns. I could see the more that I said on so great information. And tonight I heard GERD and ulcers now. They're almostly. Causes pain. Now, you bet movie up treatment so. Now, so you pass here. So, Sayari win man. We are from your Obako Doctor Juan, so one can bit in so and who figure. H. pylori Boano, Obo, the rook gray. 5 months only a fast a treated bacteria.
With Peptic ulcers, no, usually, no, the treatment, no, a combination of enro on the bema. Of course, yeah, both H. pylori, a bacteria, and you know, that they will give you antibiotics. On bema antibiotics to take. Todebia, yeah, the no say todebia cry. One the I think it's anti-gas medication.
Okay.
Now, we have what we call proton pump inhibitors. And no, Nidino, so we cost a bit to say Prilosec. Meaning say, we be who over the counter. Rebecca say bia fair in combination. First, one person almost saw H. pylori acid. So they want to treat the infection. That's the most important thing to do, is to treat the infection.
Right.
And then the other symptoms that follow, no, they can also help curtail it with these other medications. Proton pump inhibitors, usually what they do is they help stop the production of the acid. And also, say less acidic environment in your stomach. Yeah. And with that, so it has its whole other issues, because you will also have other bacteria growing, because the acid there is also to prevent other bacteria from growing. And you have to kind of be careful. And yeah, dry your person will find over the long term.
Oh, okay.
Yeah.
But if I say antibiotic now, one for H. pylori now, can sort of a bit more for what in here. Now, for Francis, also for
Pacho say,
a bit more body in here.
Yeah, a bit to me, and you have to be careful. It's usually antibiotic in your idea, a man a long term. You probably give it for 14-day treatment of antibiotics, and then ABI, they will add a proton pump inhibitor like Prilosec. ABI, your friend, my name say it's over the counter now as a omeprazole. Ibisa near the amount, and now back my friend said pantoprazole, mean kind of brand. So those are the major ones they will give you. Those are the most common. First near or antacids actually. I know your friend H2 antagonist. So obi wa to me tolerate one or the other. You can flip-flop. You don't usually give both. Until BB to say ranitidine, I think somewhere year free over the counter. I don't think they've removed it from market, I believe. But Pepsid or famotidine, a very common one, and also over the counter. You can take to help with the decrease of the stomach acid.
I think that's one of the treatments for peptic ulcer. Now, if I'm comfortable now, no antacid.
Yes.
One of the bread is so be bread because odidibia na the position and I said the yemi na push antacid bibia. So no
no, you are compromising the year of the environment. To say they kind per se environment no so they're too compromising. So we are careful with how you take medication. So into it won't say a idea you can take it as needed. Actually, what you mentioned, you can take it as needed. It'll be unstoppable. But we just want to know, say, you have to be careful, because and also side effects, and we say to me cause constipation and diarrhea. Either it could go either way, which is kind of strange. So I know depending on ingredients now what antacid no.
And I think that a okay say over now or yari na or be antacid to be.
The main thing you want to do is you want to seek help from your doctor.
Right.
Seek medical advice. Now they will do the necessary tests possible, and then they will determine what medication is best for you.
Right. Okay. Aside from H. pylori now, bacteria now, and so on for in terms of like preventative measures. Be abra when you're and near my benny so yeah, said a way enquire to say when you're stew in your blood, actually your blood in your stew, I should say.
Yeah. So near your kind of risk factors. No, you want to avoid smoking, drinking, and spicy food. You can spicy food and unnecessary stress. Something we don't mention. Stress and so to make ulcers. And these are things we want to work on. So you'll be a smoker, then you want to reconsider smoking or drinking also. Sanya, your health is your wealth. I can't say that. You want to be able to have that control over your life, then you need to in your when what idea is see spicy food. So will be able to me and yeah, there are other alternatives for spices that are not harmful, and those are things we need to explore and see where what we can use as substitute to normal spicy choice of spices.
Right.
Yeah. And like I said, stress, we want to avoid stress as much as possible. And one major, I know for me personally, one of the major ways to reduce stress is sleep. Yeah. You want to get enough sleep, which is tied to how you diet. You have to be careful. So, yes, sir.
I don't think I did any problem because maybe it was a problem.
Think about it. And you are laying down and your body is still producing acid. So if you think about that whole concept now, it's a melody of things going on in your stomach at that time, because if you eat at night, the propensity for you to lay down is high versus if you eat during the daytime if you're moving. I mean, it's not in every case, but in most cases. That's what causes all the backup of your acid and can cause GERD and hence ulcer.
Okay. And that make me, because usually it's only the area and sometimes you sleep. Is it okay at that time? Is it a particular say be a moment now producing more acid than
it could, you know what? When at night really is when your body produces a lot of things.
Okay.
And thank you for mentioning, because I know crime refi. And I do at time old and time now our body is so air producing the chemicals, air producing nyoma here, so that we be sorry no panel. Now whatever it needs for fuel or it needs for it to drive itself, it's already being produced. That possibly could be another reason why you shouldn't even eat that late, because then you tend to overproduce more than what is needed. And like I said, if there's anyone here who is a physician or a nurse, they can chime in and help out. But I believe that that's also a reason.
And I think say they are correct. So that even cholesterol crown, that's the time
right
body they produce the most. So you have more parasympathetic drive than sympathetic. We are not on any physiology.
Yeah.
Switches ideas now, then you end up having more acid production.
Right.
Until the day idea will bigger impact stomach ulcers, because any idea you good you can say now your phone you have been quite and on your beer war Susan Sophobia and some of it always a question now. Also will be about say drinking what, doctor?
Alcohol.
Please don't say alcohol.
Alcohol.
Was there any want to be
To me, you will have to make that decision for yourself. So, to me, there's no way around it. We don't cut corners when it comes to our health.
Right.
We have to address it. So, until we will be our ulcers now, we no man sadia. Meaning the American says so jai. Because, like I said, also Arabia a very funny area. Obeka say when you're in Naho, but you are losing blood, you get faint, you know. It to me leads to other things. So you really have to weigh the risk versus benefit for you. What is more important for you?
I think say I can't move down one step no. And you are saying we see who say I be emphasis of Okujan and I whether who say ebia I do muja woman. I say any muja koko, right?
Yeah, friends, because I has a digested blood, and
Right.
fat. If it's coming through your stool, your friend a dark tarry stool.
Right.
So they been so some people almost vomit it, and no dear, and yet digested blood. So and so by red ube who say obvious say there's blood in the vomit.
Right.
So that's the difference.
Yeah. And see, as a obi asimo kan about me we make a crab film about alcohol in a. We say you will be your friend you good didi. Say crofo bebre na no appetizer so no more didi. More reverse na because we be so ntimi nyai. You know.
And that's a good question. Maybe they met me, I can say you have to limit your alcohol intake. The now you have to limit it.
Right.
Because expectation, even worse than the regular alcohol, you will we have to learn to limit it. And they're very erosive to our bodies. And we know that. In him say, local alcohol, no. It has no grade feast of famine in tea. You have to learn to limit your alcohol intake. I don't believe in cutting corners. In
correct. In the MI say NSA and I'm free doctor and channel. And see, I treat Kumuya na you do stage be a pursue a wrap up the show na my doctor Echo because she has other commitments. And then Kasa from stomach ulcers and GERD. And no the protocol about the battery man to say Yamukika and I say Yamuyare. You say and never be been by the crat me the bar and a team who say conditioning no cry no so to me courses are program we. Now I work it to you or and I said no could be a friend H pylori so to me course ulcers ni baby not to say kuna about yemuno no could be a cotinamua save you dunya into no treatment and I say woman antibiotics na etimi ekum sa H pylori after so no yes baby I say wait me afa antacids in same crofo we use emra omonya indigestion. And Dr. Sanchez, you say, great, Arabia. Sometimes I have Boshishi, so what did you read now? Boshishi because with digestion, sense a better form, yeah, above ice as for chin above a bastro. Now I will go minimum, just start to say what a shishi, a Boshishi, your chest. Yes, I can say, so who said, Nima winning to cause what symptoms here of boss we, when you're bloating, especially with obu ona okoko ase ho no notice pain bi wo ho na ejina fa ko a if obu ni ka epigastric pain na e was away then okomu doctor na yema treatment na doctor abubo so be o say wetimi use antibiotics e be ma be bit say proton pump inhibitors omeprazole e ka ho na say Pravicec e ka ho enti and then yesua enema bebre na yenya questions so bebre from mo Facebook anya bia wa question bia msere for Facebook na any sakomo na yeka Facebook one sem na Nana Williams that say what you in and I would hear him will be say why is it that Ghanaian doctors don't recommend CBD and THC for ulcer patients question we know did be me afraid that makoma so ye because I'm a big proponent of CBD not the THC part but CBD will a lot of effect when it comes to gastric acid production control and I face so sound too old before say unyai alcohol and now no THC. And then say you show you and shut up and recommending we say use THC. But again, if you need it, then actually prescribe THC and they prescribe CBD. Dr. Betty at the amount. And in a way, in Williams, CBD idea oil. Some of our people in, especially US and Poma legalizing them. Some people use it to control ulcer conditions. And to doctor, let's say the back now. You wrap up the show in a way, you know. You perceive utu atie for about the name maybe over here. Ever prevent you almost sort of stomach ulcer. Now you be aware when you know what are some of the things that they have to do to solve the problem.
Okay, that's it. Brony Frey BB, when you know better, you do better. Into yeah, kakra yeah can say, as I say, we live very busy lives, and especially your woman on your lives now are so busy and so crazy. So sometimes we lose sight of what's going on. The you know, we work some of the worst shifts known to man. We do some of the bottom of the barrel jobs. And you know, we really need to take good care of ourselves. And like we have said, with GERD, and stomach ulcers, you really have to pay attention to your body. Maybe we fan say, oh, but and yes, ABI stomach ulcers. It's something I say when doctor but some of the things I able to prevent it from getting that far. No, you can't smoking, you can't drinking. Aduane a yɛdi ɛsɛ yɛhwehwɛ mu sɛ woyɛ obi a wodidi na woyɛ meyɛ ɔyɛ a ɛsɛ sɛ woyɛ careful. You watch what types of food that cause that that process. You watch it. One ɛsɛ woyɛ watchful. Yeah, na yɛyɛ guardian of our foods. You have to be a label reader. Obi a odi tomatoes a ɛkɔso even asthmatic attack. Actually, GERD, come to think about it, could lead to asthma.
Oh,
we haven't even there's a correlation. We didn't even talk about that.
Oh wow.
Yes, GERD can. Ulcers, pretty much, except for GERD, they don't use antibiotics because it's not, the etiology is not bacteria. Yeah, indeed. But we have to be careful because you have respiratory issues masked with GERD. So as I said, there's a correlation. Obi was starting your GERD symptoms, but now we're starting your asthmatic attack. As I say, you decrease your stress levels. We find ways to help us deal with stress or cope with stress. Sleep is one of them. Exercising is another. Taking a break when you actually need to do that. With COVID we hear all about self-care, and self-care you can't say anything. It's simply taking care of yourself.
Right.
Mental health. Say, we are stressed out. It takes a toll on the body itself.
Right.
The two are not mutually exclusive. They all work in sync. Right. The body and the mind, your emotions, everything works in sync. When you're emotionally healthy, now we are stressed out. It affects your body. If you're in a situation where we are stressed out, you have to remove that situation, or remove yourself from that situation, so that you can bring your body back into itself, into equilibrium, because the body always wants to do that. And then the body is trying to just fight off to come back to normal. Right.
I think some question be amount. I don't know so answer now, but coffee, right? Coffee idea about America and other countries. Now I think some review baby said, it can actually cause stomach ulcers.
It can. It can. Yes. Caffeine can irritate and propagate stomach ulcers. That's absolutely correct. Yeah.
Yeah. And see, mom, coffee. If you more, maybe say me when I'm in coffee, I mean, me non pet menya this upset. So then the question becomes, say, answer Rebecca say, oh, I did menya stomach ulcer. I said a person and maybe for some time, and I say, maybe once a while, be not we it's okay. Is it a normal thing?
Oh, my patcho bisa question will be on why.
Like, sometimes obi to me here, or to me all these symptoms here, I try be about 1 or 2 days now. And also this selling food be an edema. I don't know. I saw the doctor now say or no antibiotic antacid be near the or you okay?
It depends on one who say you are really the author of your body. Me fan say I will have to gauge. The idea me first say course 1, 2, 3 days. Yeah, I will call my doctor. Yeah, I yelled that until feel say oh mefa antacid. Antacid is very general and broad based. Until sometimes we'll far it works. Sometimes we'll far it won't work. Until you have to decide for yourself. So I cost it be 2 days. I mean, any resolution in the symptoms. And before I will be Drobiano, you should be contacting some kind of professional, whether it's a pharmacist, doctor, nurse, whoever in your circle, you can reach quickly, When you are the next best thing is to get a hold of your doctor and let them determine what's going on with your body.
Right. I think that's a very good way to put it, because and maybe and I have tried say bit me solving any problems. I want to be the comment to be about Hanuma. It's speaking to the fact that you still have our medicines, exercise to treat a lot of diseases. Practical say one of those things that what me you should herbs, and I mean that's pretty much what this person is asking.
I think it's a good we need to explore the use of herbs. We don't do it well enough. I think Africans need to jump on that bandwagon. That's an opportunity because say Ghana say herbal clinics are really there. But the question is, how are we standardizing the medications we are giving?
Right.
That is, I don't have a problem with alternative medicine. I always say this, but we need to learn to standardize. We need to go back, take those back to our labs and analyze them, do what we need to do to promote them. The Chinese are doing it. I don't see why we can't do it. But it's all in the kind of leadership we have. So I think we can explore. The answer to the question is we can explore using herbs. Exercise is always good for everything. Exercise is an adaptogen for life. And anybody who knows me knows that I'm a proponent of exercise. So yes, we need to exercise more and also explore the use of herbs. Me idea, as I said, I think we've talked about this before. Right. So say not just talk about it.
Right. We just act on it. I think that and the direct Pimmy right? And I think at this point in the show you about every year. Dr. Esther Ojayan Jan Manako at 11:13. Mom tune in the Munasi, Mom with the commenting by and so Damasi. And so next week in the West End show for Abraham on your way on Akko Radio Health and Wellness Show. And say every time behind I can say show you the doctors about a moment room baby. And they assume they may be about pepsi course. Now next week in someone Musan tune in if ever have I know say next week Kwame Beba Betana Jim na maternity one. Into yen same baby in a commercial break now you end the show. That's a bit brave.
Wow! Me pa na fi ma file me tax including dia kwa mami. Na ene se afe no akwa wiye me tax file na beye me asompidie ene nkwada na. Nanso with Akunim and Associates say die menyo butantim e me tax issues ahodi nyina mu. Onua wow anything e was file or tax with smile. IRS for editable atoso. Womu hunehuna, womu tata, wo file or taxa. Dapia da uboka, usika unya ekituebi. Make no mistake. Fahobo Akunim and Associates. With Akunim and Associates, what tax filing ebedano S gracia ubeji boom, no problem with IRS. Yes, or your experts were individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support, electronic filing of both federal and state filing, and NSM, Akunim and Associates, State Bia, Iowa, America, Kroponimono, Mepacho, Womu, Ewo, GDA, Anamon, Quine, Pasua, Wombetime, True, Akoshem, Quan, Ewo, tax filing, Ain't Baby Bia will be a Utimi, any Akunim and Associates, Etokese, Najuma Dian, Obonti, Akunim and Associates, a deal Bia the friends, Ura gender, not just say, Wakudarimu, Abeng, Ewo, tax filing, Fawobadan Womo, Shishawana Chi, Quine, Ewo offices, Audua, Edisway, first location, 684 West Boughton Road, Suite 201. Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre Openi Kwanchaf Wanum Ewo. Telephone number 773-6101-112. Number NBM is 773-6101-112. One fax number is 708-247-3454. I feel bit my email no akunim.info@gmail.com. Akunim and Associates, yes, Nukrenie, open kunim die or tax mudia. This is what took us with Akunim and Associates. ANG Nkwa.
Minia ba eni ma medufi oyedwuma odukasi anopa biara minia ba sori ahoɔden mu na ɔkwadwuma on complaining ja sɛ ho ba bitutu no sanso na mebra o efitani o tu engine na o pagya engine be ka adwuma sɛ de sitie da bi biara no ho dendenden mia meyire o store no adi ni dwa meyire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanem papa ne mfia konkan ɔno so complaining da sɛ de ho ba bia ne ya ɔsori anopa na no afanse kan na ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de beda mpo na adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a wonom a ebo nipadua no ma wo se pi usita me kanfo ama wo se won so no nom kowa mesani bi na baboa na aboa no obusua na yareda ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a frɛ telephone number
0591 565 778 0509 876 891 and 0547 641 310. Say wo pe kwa mixture ato ewa America brochi memu called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonana Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintas
FDA ahwehwe edwadi nkratuo yi agiatum se eye.
Jo yeda masese mugusu na mutie na me won kratuo kakra bi ampese me de ma etiefo mahu se me wofa Patrick say Ocean from Spain, but that's be said Ocean last in Kraton person me de ma atiefo ne ye one more Chicago hanum no I think next week you be Ghana Community Health Clinic here clinic bia yaka abum na ye this song for one more Chicago especially Chicago City and then suburbs ni na say we Ghana ni na say we will be a ohia apomudin check up obetimi aba Ghana Community Health Clinic your Dr. Prince Hodogbe ne Dr. Jamila Okoy Dr. Eunice Cromwell me ameti her nso me ka ho ɛna Dr. Habiba nso so ɛka ho saa team yi na yɛaka yɛn ho abom na yɛate clinic bi a ɛyɛ free open say oba na you check your blood or blood sugar level or blood pressure nema bebre wo kwa betimi ayi ahwe ama your doctor for makwadare mu. In addition, you sign with volunteers bebre mo be every month bia na organize a clinic once every month. Now this particular month on the Saturday 11th June 11th you be here with the Church of Pentecost Romeoville. Address near 302 Els Butler Road, Romeoville, Illinois, 60446. Over a platform, so a wiki near the address never to one, as opposite Oba Clinic Ibia, a beboa. And the Ohon, among what Chicago and Mr. I won't take advantage of this. Now, Moncanche Momaka said there will be a Ghana Community Health Clinic visit. Romeoville, not Mumram numbers. Now, Mumesha Mapumudin. In the show way, show be a encourage Senko for and I say, one would and a bit take your health serious. And I offer free community health clinic, Unya insurance, Unya ready. Obama nurses, need doctors, special and pharmacists, and more drew. And Mr. Wam take advantage of this. And now, the EDBC next week, if I sign about you, now you're about heading. I bet what you mediation tea. Want to make a view. I better Yakupon say what can you show you about and I really talking until you be sent next week.
Just one more pic, JJ, please.
Oh, Mama, really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.